Commissioner, can you hear me now?
Yeah.
Okay, thank you. Well, good morning, everybody, and we're here for our weekly briefing on the emerging health issues, some of the COVID update. So situational awareness, it's no secret we've got a lot of disease activity going on in Tarrant County. Unfortunately, the Christmas spike is starting to hit. Last week, I think you all saw the numbers. There were 3,000, 3,300, 4,200 on one day, but that's a 2-day count. This morning seems a little bit lower. I think we're under 2,000. So that's relatively good news. But overall, 161,000 cases. We're going too fast. Too many cases happening. Last week, the week of Christmas, we reported out over 19,000 cases in 1 week. That is just a huge, huge spike. And more to come because, the holiday effect is going to linger for a little bit. 1,550 deaths in Tarrant County so far. I think we're adding another 8 or so this morning. Hospitalizations, uptrend is continuing. Our hospitals are full. We have 1,426 patients with COVID. It's getting everywhere. So it's in the hospitals as patients. Staff are getting sick. They're trying to manage the best they can, but we're 31.7% of the hospital available bed capacity is consumed with COVID. And I believe 38% of the people in the hospitals in Tarrant County have COVID. 272 are in the ICU. That's 51.7%. Of all the people in the ICU that have COVID, the capacity is consumed with COVID. 1 in 5 total patients that have COVID end up in the ICU, so that's a 20% ICU requirement. As the numbers grow, that requirement's going to grow. And as you can see, we're again down to about 9 ICU beds remaining in Tarrant County. So one thing I want to point out, we've talked about this every week. We're 6 beds, 10 beds, 9 beds, and the numbers keep growing. How is that happening? I got to give credit to our hospital partners for really trying to manage that. They're trying to increase bed capacity, but they have staffing challenges, and they're also trying to triage other people that may have needed ICU care and trying to treat them outside of the ICU. So they're doing a good job keeping the beds available for absolutely critical functions, but that puts a pressure on the healthcare system. It lends to poor health outcomes elsewhere. People who may have cancer, people who may have heart disease, may need ICU care, and we need to save that capacity for those type of critical events. Somebody with a massive trauma. Things happen in life that are still happening despite COVID. TSAE is no exception. 24.65%, almost 25% of our TSAE, the 19-county region, is consumed with COVID. The hospital capacity is full with COVID. 3,844 people in the 19-county region. We're 64% above the threshold of 15%, which was already very high, as you can imagine. By the time we got there, we were all feeling the pain of COVID, and now we're 64% above that. TSAE is the leader in all of Texas. Our region is suffering the most. Houston area is a distant second with only 19% of COVID hospitalization. So we've been saying this for a while. We've got to do our part to keep this at bay. Otherwise, we're in a lot of trouble. 70 ICU beds for the North Texas area for the TSAE. So that's hospitalization. Again, there's nothing I can say in here that's any surprise. Again, we all got to do our part.
I will say this on the hospitalization rate. A lot of times, it just happens to fall on how many beds you've got. And while Harris County is certainly a little over twice as large in population as Tarrant, they have over 3 times as many hospital beds. So that also has a consequence to that calculation, and that's just in Harris County. That doesn't include the surrounding counties that also are in there. But at the same time, Tarrant counties doesn't include
that gray, the big capsule.
Hospital trends, again, this is Tarrant County data. We're
Make them hungry,
as you can see.
That's what.
Really no signs.
No, that'd make them hungry.
That's what was in the floor.
TSAE in
No,
the
let's
same
make them hungry.
situation.
Okay, cool.
spiking real hard.
That's what we found yesterday.
Just
make them hungry.
Case counts, the way we look at the outbreak happening in the community, as you can see, is big peaks in the recent weeks. And of course, the case volume is a different epi curve that kind of shows the workload that our public health team and our hospital systems are dealing with. Because these folks some of them are in the hospital, and some of them are out in the community being sick, so they're being seen, they're being tested, followed up with public health. A lot of happening, as you can see, a big spike, 20,000, close to 20,000 cases, 19,000 and some change in the previous week. Case rates, we've talked about it. The federal government, the White House task force set up a ceiling, so to speak. This is where they thought things were going to get bad, 100 per 100,000. And this is based on a lot of science, right? Most diseases are lower than that. Only a few that are sort of insidious, spread quietly, get higher case rates. But most illnesses don't have this high. We're 6 times that. We're at about 600 per 100,000. I can't really see all the numbers, but we've cut 600 and come back down a little bit. And mortality data is starting to follow as expected. It takes a while to show up in our records, but people are dying with COVID, and we've at least matched what we saw in July. There was one bar that was higher, but I think we're getting there, and more to come because there's just been too many cases. COVID-like illness, again, spiking, and then the positivity rate is an unbelievable number. We're at about 25%. I think one in 5 people all across Texas getting tested are coming back positive. So it's a lot of disease activity all across Texas. So what can be done? And I know that the governor's orders allow us to do only certain things, but community mitigation efforts, when we put them in play, they work. They must be available as an option. In the absence of that, there's very few things that can turn the tide for COVID. There are therapeutics. There's efforts underway to open pre-hospital infusion centers. I believe our emergency management folks might have an update later on that. But what they are related to monoclonal antibodies. We've talked about our president got the Regeneron treatment, and there's another company, Eli Lilly. So they both have monoclonal antibodies, and those treatments are available in Tarrant County. What they do is, generally for most people who take it, people feel better in about 3 to 4 days, 75% improvement in symptoms for most recipients. But the real benefit is about a 5% reduction in hospitalizations of all the people who take it. And when you're that full on hospital capacity, every percentage point that we can knock off really matters. So I encourage, TDM has been the lead on this, the Texas Department of Emergency Management. And I appreciate their efforts and our county's efforts and city's efforts for trying to pull this together.
So frustrating with this guy.
Is a strong vaccine uptake. I know the numbers are limited, and we're going to talk about that a little bit. But as vaccine becomes available and people become eligible, we really need to take that vaccine, because that's one sure shot way to calm down the COVID outbreak. Because otherwise, we don't have other tools available at this point to do anything that will stop the spread. So if there's any question, I'll be happy to answer, but I know there's probably going to be a little bit, either Mr. Manius or Mr. McCurdy might have an update on the pre-hospital infusion centers.
So let's talk a little bit about the infusion center right now. We're currently, emergency management is currently working with TDM and the state in an attempt to set up an infusion center here in Tarrant County. We are still in the development stage. We've found a location we believe is going to work. We don't want to necessarily reveal that location right now, simply because we don't know if that's going to be the final location. But we do want you to know that we do believe that we will be able to set something like this up. We're looking at maybe at any given time, 10 to 15 individuals at a time can receive the medication. And hopefully within the next week or two, we'll be able to provide some additional information to you. This will only be one of 2 or 3 sites across the state that actually has an infusion center that is not inside of a hospital itself. So we're working on that. It looks very positive. Once again, we have to compliment our partners, Texas Department or Division of Emergency Management. They've stepped up on this thing, and as I said, hopefully within a couple of weeks we'll be able to introduce this site to not only the court but also the community.
GK, I know that right now we are operating in an environment where the vaccine is a scarce commodity.
Yes, sir.
But that will not always be the case. I think that in the next week to 2 to 3 weeks, as we get more and more vaccine deliveries, we will have less and less pressure on the system from having a limited supply of vaccine. We need to use that period of time between now and when the vaccine becomes plentiful to gear up to vaccinate everybody in Tarrant County. We need, in effect, a place to get a shot on just about every corner in our community. Certainly in every neighborhood in our community. Since the availability of the vaccine, nationally, we've only immunized a little more than 4 million people. I've heard a goal put out there that we should be vaccinating 1 million people a day across this country. And that even if we get to that goal of vaccinating 1 million people a day, it will take 300 days to vaccinate the entire population. Well, this is a massive undertaking, and we can't do that without having a plan. I want us to have a local plan for how we're going to vaccinate our county. Infusion center is great. We probably need 40 or 50 of them instead of just one. There are many public facilities that we can turn into vaccination centers,
Right.
whether they are JPS community clinics, public health clinics, WIC locations, FQHC sites, community centers, libraries, churches, synagogues, mosques. All of these people stand ready to lend their facilities and their staffs. Many of these churches and synagogues and mosques have retired nurses as members of their various congregations. These are resources that we ought to know where they are and how to reach out and get them and have a plan for a system of vaccination centers, including mobile units that go around the county.
So
We need a plan.
So, Commissioner, we have started working on a plan. Now, it's not as intensive as what you've described, and I I think that you have some slides on that, but when we get up to our section, we're going to talk a little bit about what we're doing in the near future, within a week to 10 days, and then step that out in the next 2 or 3 weeks. But those plans would include basically opening up sites that are mass vaccination sites, some that can handle up to 1,500 to 2,000 a day in vaccinations, those type of deals.
Let me put a goal out there for you.
Okay.
GK. I'd like to see us have the capability in Tarrant County to vaccinate 100,000 people a day.
Okay. We'll start working on it.
So before we move on, I had a question specifically about the infusion centers. I wanted to make sure that I understood. So hospitals can stand up their own infusion centers, right?
Yes, they do in the outpatient settings. They've been doing that, yes, ma'am.
How many hospitals right now in Tarrant County have that?
I don't have an accurate count, but I've heard at least a handful have used it.
Okay.
Again, this has been sort of not the public health swim lane. It's
Sure.
hospitals and state effort. So we kind of on the outside know that there's at least been 5 or 6 that have in conversation said that they've been using it.
Okay.
And from what I hear, TDM has had some feedback that there's more doses sitting that are not being used. So the governor has tasked them to kind of get it out. So that's what the push behind this is, that they want to do pre-hospital infusion centers. Makes good sense to me because it reduces hospitalization, so we'll take it.
Sure. Well, and then, because here's what I want to be sensitive to is, my understanding is that in order to get the treatment through the hospital outpatient facility, you would need a referral from a physician, right? And not everyone either has insurance or has a PCP or whoever would provide that referral. So I imagine that our site would serve the general public, including those who are uninsured or don't have a referral.
So I'm a little light on operational details. Again,
Okay.
It's an effort between Texas Department of Emergency Management, our emergency management, and local fire departments.
Okay.
Some in direct contact with TDM. So they have a vendor, I know, that they've engaged. The vendor is supposed to bring a full turnkey package. So that's all I know. And I've tried to stay, out of that lane because it's between them and the fire departments and emergency management. Only thing they asked us was, what's the benefit? Should we do this? And I gave them the science on what's the benefit is, just like I shared with you. After that, it's been kind of their ball and they're running with it.
Okay.
So sorry, I don't have full operational details, just
Sure.
that they have a vendor that's going to help them out.
Okay.
Yeah.
Well, so then, GK, when you provide the next update, I would like to understand the plan to ensure that we are serving the greatest number of people with this public infusion center.
So just in case y'all don't know who's talking, it's Vinny Taneja, the Tarrant County Public Health Director. He is not a doctor, does not have a doctorate degree whatsoever. He has a master's in public health. He has an MBS in from India, which is not recognized as a PhD here, nor does he have any license to study any kind of medicines at all or give any kind of medical advice. Can't do anything. He's not a physician assistant. He has 0 certifications, and I've already checked this out and verified this with Texas, the Texas Physicians Certification, the medical board, all of it. Anybody that has to do with certifications, he is not on there. So it's frustrating to listen to him, especially when you look at that same day that he talks about these vaccines, these mandates and all that. It's really frustrating when none of his numbers add up to what the DSHS numbers are. That's frustrating.
Obviously, we know that COVID doesn't discriminate, but then there are so many factors that some are disproportionately affected by COVID. So I'd want to make sure, just like this and with the vaccine, that the distribution and the access is equitable. So,
Yes, ma'am.
okay, thank you. That's all I had.
So again, just for, general public, I mean, we know there was policy discussion on the previous slide, but general public, what can we do? Same thing, get vaccinated, wear a mask, stay 6 feet away from others, and wash hands often. I mean, this is, by now, every child should be able to say this and do this, because this has been the mantra. This is the way out, and if people do it, we have a way out. So vaccination efforts, and we'll go into some of the details.
He said that this is a way out by washing your hands. Okay, of course you should have hygiene for that. I get that. I mean that's the common sense. But he says the mask and washing hands is the way out. For the last year, that has worked really well with the mask. Might want to try a different kind of science because that science is failing this guy.
On what we've done, what kind of plan is there, and Commissioner, some of your comments are very well taken, but I can share with you what the plan is from what we know, and then of course we'll add whatever the comments are and work on that as well. So vaccine interest has been very, very high, which is great news. Right off the gate, I want to say our community has responded very well, and we were worried that the response was going to be slow, but right now the demand has outstripped supply, so that's great for us. It presents its own challenges, but it's great news in general. Over 160,000 people have registered through our registration portal. 136,000 are currently eligible. The others are eligible in future. So it's not like they're not eligible, they're eligible in the future when more phases open up. So 85% of the folks registering are currently eligible. That means they are getting the information, they're understanding if they're eligible or not, because otherwise the entire county would have registered if they did not understand. So only those that are eligible are truly registered. 8,364 doses have been given out as of yesterday just by public health and working with our partners in MedStar and the Fort Worth Fire Department. And 3,000 have been given out by Arlington. And let me be very clear. In the public sector arena, public health governmental entity arena, we're the North Texas leader, and I would contend to say, I've looked around, I think we're probably going to be the leader across the state in giving the vaccine out this fast. If you put the math together, between the two entities, we've run maybe less than 8 days, maybe 8 days, and we were given out over 11,000 doses. So that's working out to be, 1,200-1,300 doses a day between the two of us. Public health alone has given out over 1,000 a day on average, which included bad weather days, included holidays where it was hard. We invited people, they didn't show up. So there was a lot of moving parts. DSHS dashboard shows that Tarrant County has only given out 22,000 and some doses. I can guarantee you this data is way behind. Just talking to our partners, I'm pretty comfortable saying that we're almost double that amount that has already been given out. They've had some glitches in their dashboard and the data not reaching their immunization registry in a timely fashion and then not getting updated. They've tried to work on ways. There's a dual reporting mechanism right now. Report to DSHS and then report to TDEM. We're hoping to get that resolved with DSHS. But currently, I can guarantee you, and that goes into national numbers too. You mentioned 4 million. If this happens in multiple spots, I'm sure the number's higher, it's just not being seen. So
before you move on, that 22,000 number, is there a typo in that? Because did you say?
Is there a what on that?
Will you restate what this DSH's dashboard shows?
Yes, so the DSH's dashboard shows that we've only administered 22,776 as a county, but talking to our partners in the hospitals and what we've done in public health, we've given, public health and Arlington together have given over 11,000. The dashboard's showing we've given 6,000. Okay. So that means about half is missing. And I can tell you the hospitals have had a call with us. They're saying, no, we've done a lot more. It's just not showing up on the dashboard. Okay. So a lot more has been given than what is being shown on their dashboard.
So before you leave that slide,
yes, sir.
So let's talk a little bit about that. There are multiple players who are giving vaccinations. And one of the issues what Vinny talked about was we don't have an accurate count because we send the data down to the state and there's an issue with the state system that it's not capturing all that data. It's not capturing it from the hospitals, it's not capturing it from the other counties, it's not capturing it from us. The hospitals have received a an element, their vaccines, and they're giving out the vaccinations to their staff. And so that adds to the numbers that you see for Tarrant County. Vinny, do we know, I know that those individuals that are in nursing homes or in those in assistance facilities that the state is going to do that through the pharmacies. Do we know if they have started that yet?
Yes, sir. As of December 28th, so there was a federal partnership with CVS and Walgreens, and they were supposed to be immunizing our long-term care facilities, including nursing homes and assisted living. That program has started as of December 28th. Our staff did receive a statewide spreadsheet, and I believe they've analyzed the data. I forgot to add the numbers, and I don't want to speak inaccurately, but a few hundred doses have already been given, and they've already kind of outlined how they're going to go. Problem I think they're up against is a lot of nursing homes, again, are having outbreaks, and that's where you can't go and give the vaccine because you can't give it to a person actively either having an illness or quarantining. So there's some challenges in that aspect as well. But they're working, they're doing that effort, and I'll try to add the numbers as we get a little bit more clearer information on that.
Vinny, I thought that you had indicated that there was over 200 of those facilities in Tarrant County.
Yes, sir.
When I got something came out, an email came out at the end of the day yesterday that talked about the partnership with CVS and Walgreens, and when I sorted that by Tarrant County, there were only 45 different locations that were noted in Tarrant County on this deal.
I will look at that spreadsheet as well. I think we got the same spreadsheet. I'm looking at the state database where the signups happened. The last I checked, there were 278 facilities identified by DSHS, because they regulate, or HHSC regulates these facilities, and 201 definitely had signed up under the federal program. After that, I haven't gone back to look if there's been any changes. And I think I mentioned to you there's supposed to be a Texas program as well. The details have been thin. We've asked a couple of times and haven't gotten a good answer. So we know that 201 entities signed up, that's for sure, because I saw that with my own eyes. Yes, they're signed up.
And who's administering the Texas plan?
That part, we asked and the details were not forthcoming. So we'll keep asking, and I'm sure, because we got to resolve the other 77 facilities. They can't be left alone, so we'll keep working on that. So here's the update just from what we've administered, and this is about a day and a half, maybe 2 days behind. So this was till Sunday evening, but the numbers still hold up because these are percentages. So coverage by city, as you can imagine, Fort Worth being the largest city, 40% of the people who got the vaccine ended up from Fort Worth. 9% from Arlington, 4% from North Richland Hills, and the numbers keep going lower. And these are the numbers that floated to the top. And there's, 2, 5, 10, and I'm telling you, all of North Texas, a couple of people from San Antonio, and we try to filter everything that, we can by the county. But there is a challenge. A lot of our county staff, a lot of city staff, a lot of other people who work in Tarrant County that are healthcare providers live outside of the county. So we've had to let people in with an ID badge of some sort. I work here. Okay, I mean, we're trying the best we can to limit it to Tarrant County, but, it's hard to say no as a public health entity. We know that vaccination is going to be done together. It can't be so restrictive that you're out. That's not going to work, So we're trying to manage the best we can, and generally it's working. Even in our eligible list, we looked at the data. About 15% or 10% were out-of-county residents. 90% were Tarrant County residents.
But
so,
Vinny, I understand,
yes,
I understand how hard it is to say no to someone.
yes, sir.
But when we get, and I think I've handed you, or did,
Yes, sir. I got it. Yes, sir.
and I guess what I'm saying is we've got to make a new plan.
I'll get to that.
Because-
I have that addressed in here. Yes, sir. We'll get to that.
Well, I want you to address specifically what I'm putting on this sheet,
Yes, sir.
because
Yes, sir.
we've been talking about this for a week, and we've still got lines outside,
Yes, sir.
and that's got to stop.
I-
It's got to stop.
Okay.
Not just we're going to talk about it, it's got to stop.
So let me get to that in a couple of slides, but mass vaccinations do happen with lines.
They're not going to be outside if they're going to be in Tarrant
I
County.
understood. Yes, sir. We'll get to that just in a second. So let me show this. I know there's interest in who got it. So the younger age group, 18 to 64, was 76%. But that's where a lot of our first responders are, a lot of our 1A eligible healthcare providers, nurses, doctors, all of those folks are. So that's why that group is bigger. 65 and older, 24%. Those are the straight up 1B. But even in 1B, a lot of people are in that younger age group with underlying health conditions. So that's how that number is shaking out to be. Ethnicity data, and this is where we're already starting to see outreach efforts needing to be stronger. Non-Hispanic or non-Latino, 89%. Declined to specify 6%, and Hispanic only 5%. So certainly an outreach effort that needs to be increased to get to our Hispanic community. It's got to be proportionate. In our community, I think we have upwards of 25%, maybe 30% Hispanic community. And I'm hoping that we get the numbers up there to start addressing it at least equally, if not better. Race and ethnicity data, 93% white, 4% Asian, 3% black or African American. And other races were, at least on a percentage basis, 0, but there were 1 or 2, a few handful of folks. Again, outreach efforts are going to have to be very strong. Reverend Emerson has reached out. We're going to work with him on sort of town hall style discussions with the African American community to engage people. So there's going to be efforts underway, but that's where I need leadership to step in and start getting the word out with us that as people hear about the vaccine effort, they need to sign up so we can qualify if folks are eligible or not, and then call appropriate groups so that we can do this in an equitable fashion instead of just whoever came.
Again, I've had a number of people call in. I had one call in this morning that basically said, I registered a week ago. I got an indication when I submitted it that they'd gotten the application, but I've not heard from anybody. I had a customer that I told about it yesterday. They filled out the registration and sent it in, and they got called that afternoon for an appointment.
Yes, sir.
So how,
So
one's over, both of them were over 70.
So I have an order. So the process slides are a little bit later. So if you want, I can go there and come back, or if you want to address the challenges,
We can wait and
Yes,
come,
sir.
we can
Yeah.
wait
Yes, sir.
till later.
Can we
But I'm,
go back a
Yes, sir.
slide?
Yes, ma'am. So are there challenges?
No. Let's go back to the previous
Oh.
slide with the demographics.
Yes, ma'am.
It's very concerning.
It is,
I think
absolutely.
with any system, and this one is currently built on scarcity, then it makes it rife for inequality. And even though there has been a considerable interest in the vaccine, there still are a number of folks who have concerns about the vaccine, and they're not going to jump to the front of the line. And I mean, there are some folks who can't afford to wait 4 or 5 hours in line for a vaccine. So I want to make sure we're not grazing over this.
Yes, ma'am.
This is very concerning.
That's why I brought it to you all, because again, public health alone won't be able to do this. We need the
Sure.
leadership to rally the folks.
Sure, yes, and
Yes, ma'am.
we've had multiple conversations about it. So
Yes, ma'am.
I don't think that there's necessarily a lack of leadership here or in the community. I think
Mm-hmm.
people are waiting to be tasked with, here's how we need you to help. And Commissioner Brooks spoke to that earlier. And I think it's important, this has been a regular theme, not just with public health issues, but other things with the county, is us making sure that our messaging is translated. Right now, I don't believe that we have enough translated so that we're making sure that for folks who English is not their first language or preferred language, that they even can access the website and complete the registration. So we cannot see numbers like this again.
Absolutely, we understand. So the general information website can be translated. It's just a click of a button. It translates on its own. We're working on the registration form in multiple languages. The challenge then becomes, like, if people fill it out in other languages, sometimes we have issues absorbing the information. So we're working on that as well. As far as other informational material, video loops in multiple languages, we're working on that as well. I think my team had given me like a timeline, like this week or early next week, we'll have video loops ready to play in the Arlington site in 3 languages. And then some other locations where we might have video monitors are going to get that as well. The current resource location doesn't have video monitors, so we're trying to see if there's anything that can be wheeled in, but there's a risk of it falling over. So we're kind of working through some of those logistical challenges. So, but yes, we know, we understand, and we totally appreciate where you're coming from. We're working on it.
Vinny, one more thing. There needs to be a mechanism for people who are not electronically enabled, people who don't do internet, people whose neighborhoods are not connected, to be able to get registered in a way that does not include going to the website.
Yes, sir. There is. So as with COVID information and testing scheduling, same thing with vaccine scheduling, our hotline is available. And, you know, we have people that can speak English, Spanish, and Vietnamese. And if there are other languages, we have the translator service available that can get on the phone with us. So people have been calling. The volume has been through the roof. Yesterday alone, we're at 3,500 calls with a lot of wait lines. And again, there's limited resources, as you understand. So if we're trying to balance, because the contact tracing calls haven't stopped. So people needing testing and contact tracing efforts, that's been blowing up our hotline, and now we've added this. So there's not an unlimited capacity. It's a balance. You know,
Okay. So we need to get to the point where we're not operating from scarcity.
Yes, sir.
If we need to add resources to expand the bandwidth of the website, to expand the lines available to those who are calling in and the persons who would answer those phones. We need to eliminate barriers.
Yes, sir.
And in order to do that, we need to add resources. But in order to add resources, we need a plan.
Yes, sir. And let me get to that. So, are there challenges? Yes, absolutely. All of those things we've been facing and we've been addressing, you know, as fast as we can. And as you know, standing up resources takes a little bit of time and some planning. So, question is, well, why didn't we do this ahead of time? Well, the national and the state plan did not call for this effort. We clarified several times. There was no money for vaccination specifically. When we asked about the plans being rolled out, they were a distributed vaccination plan at every corner. Hospitals will get it, providers will get it, pharmacies will get it. There will be a glut of vaccine at every corner. So public health, you're just another provider. That was very clear in the national and state plans. We asked H1N1, we stand up mass vaccination sites. Are we expected to do that? Shoulders were shrugged. This is the national plan. This is the state plan. Everybody. So the answer was, to avoid risk of COVID outbreak, we don't want large lines and large gatherings, so we're going to leverage the existing infrastructure. Organically, what's happening is, as luckily public health department here got more vaccine than a lot of other places in the state. And organically, it's turned into a mass vaccination effort. Let me explain. Our plan called for a first step of Alpha Pod for first responders only. Then the plan rolled out, it's Group 1A, and we were trying to see if healthcare workers would go to the hospitals. We worked with the state and local pharmacies to get a special deal done with Kroger Health, that they would receive vaccinations to do private providers and home health entities so we can do first responders at our Alpha Pod. We practiced that for years. It was supposed to be a secretive location, not open to the public, no long lines. Bring your ambulance unit, bring your fire truck, and we'll do them, you know, vaccinate them as they come. That's what it was supposed to be. The delay of delivery of the vaccine and the approval of that plan going to private providers, a mad crush of doctors and their offices calling us, we're being left out. We worked with Tarrant County Medical Society to open up our resource connection location to those providers, word of mouth spread on social media and other places, public can go. At the same time, Governor's plan moved up 1B, which is general public, to open up at the same time, and the letter came from DSHS saying pivot between the two. We had only our private closed pod operating at that point, and the public started showing up. Can't say no. So we
Yes,
had
you
to,
can.
well,
Yes, you can.
no, sir, that
If
was,
you tell 200 people to show up on a Friday, and they show up and they don't get their shots because you've let 400 people get ahead of them, then
no, that's not happening. So that is not
yes,
happening.
it is.
Well, let me explain what is happening. So what was happening during the holiday week is when we started giving out the first responder shots. We called 700 people, 300 show up because they're on holiday. And then the public start to show up, and we have a clear directive from DSHS. Don't sit on the vaccine. Pivot between 1A and 1B. If there's eligible at your door, don't turn them away. That's when we, without appointment, allowed them. It was not that we called them at that time. That's when we allowed them to, come and get the vaccine, to fill those unfilled spots, because the show rate was very poor because it was the holidays. So as the holiday weekend went by, we got more registration data and we started calling people. Their show rate was poor. We were getting anywhere between 25 to 30% no-shows and other people showing up. So we took them for a little bit, and then what we did was we expanded our call out. So if I'm gonna vaccinate 100 people, we started calling 125 people, and that worked for a couple of days. And then when uninvited people showed up, we started to send them back. You were not invited, you go back, we'll call you when your number is up. So then, yesterday, the weather was nice. So we called our max capacity, and they showed up because the weather was nice. And people who missed during the New Year holiday and all that kind of stuff, they showed up because they missed their appointments. So that's how it has been. And again, this is a organically growing mass vaccination plan, not something that we had originally wanted to do. And weather has been a challenge, we understand. But again, we're in the process of finding new sites. I think Mr. Manius has got a final sort of draft of a location that has covered parking. You're aware of that. And thank you for helping us find that location, by the way. And so we're ready to move on to that location and temporarily maybe, find a different plan for resource and do something different with it. But I want to address these folks. I know you've gotten feedback.
Vinny, you're sitting here describing something that I'm not sure exists. I can't tell you how many phone calls I get from people who said, well, I showed up at 10 o'clock when my appointment was. I ended up getting in a mile-long line. Nobody came back and asked me if I had an appointment. The people in front of me were from other counties. Or Bud Kennedy's tweets out yesterday at 7:30, y'all come. If you've got an appointment today, y'all come. Somebody should have gone through the line and said, it's 8 o'clock. If you had an 8 o'clock appointment, you come to the front.
Well, you're welcome to come there, sir. Our staff walk up and down all day long carrying their phones and iPads and checking people's appointments. We go all the way to the end of the line. I've gotten the same feedback from city partners saying, well, can we come help you? Yes, you can, because my staff are tired of getting cussed out, quite honestly, because when you tell people you don't have an appointment, they start, giving us names. Which
Well,
is
we get call those names every Tuesday.
Yes, sir.
Just wait a few minutes and they'll be up here.
Yes, sir.
So get a tough skin.
And the fact that they made light of us not doing that. We don't do that. We call them exactly what they are, which is tyrants. And if that's considered crazy talk, then is what it is. But the fact, if you say I can get tough skin, there's a difference between tough skin and people giving you rationale thinking along with facts. But yeah, that's your lovely county judge.
Yes, sir.
And
That's
tell
what
the
we're
people who
doing.
don't have an appointment, you gotta go to the back of the line.
Well, we're sending them home because there's not enough vaccine. So just so that you know.
Well, you're saying you're sending them home,
Yes, sir.
but that's not what I'm hearing.
People are giving you stories from when we didn't do that during the holiday
was
week. 'Cause there
yesterday.
was, well, I'm telling you, because I talk to
I love
staff
the
several
flack.
times a day, and I've been there on the site. I've helped send people home because they didn't have an appointment.
Here's what I want to recommend that we begin doing. And I know what you said before about weather, but I don't want citizens standing in line outside in the uncovered outside area when it's 50 degrees or when it's raining.
Understood. So,
Well, now you say you understand it, but for the last week, it's continued to go on.
okay.
So I want to move past the understanding to the point of where you're not going to do it.
Yes, sir, but we can't cancel all these appointments.
Yes, you can.
So the throughput will be just a couple hundred a day. So there's a balance. This is, again, mass vaccinations don't
Want
happen.
them standing outside.
Understood, yes, sir,
Okay.
yes, sir.
I have a question for you, not related to the lines, but related to the first responders and anyone else who, well, I guess first responders that were in the 1A category. What percentage of our first responders in Tarrant County have been vaccinated? Do we have a rough number?
I'll ask the staff to get us
Okay.
some data. I know that we have more data on how many actually registered. It's a little hard because the data coming from the state is what I was able to show you, and that doesn't capture that. So we'll do a little bit of a analysis of our own information and get you some of that.
Well, and then to the judge's point is, obviously we get the complaints. I mean, I think all of us up here have just been inundated with calls and have not been able to answer questions, at least I have not been able to answer questions to the satisfaction of the people who I represent, which I understand that, you know, with much of COVID has been hurry up and wait. That's asking a lot of our community. We are asking them to do a lot, and then once the vaccine presents itself, then they're still waiting. And, you know, obviously it's gonna be a process, but, and so I get that perhaps what's come to us has been the complaints rather than what has worked well, but it's been significant. I mean,
Absolutely.
And we just, and
We've
I
heard that
understand
as
that you
well.
all are working on a plan.
Yes, ma'am.
I want to hear about what we're going to do moving from today forward, and also incorporating what some, you know, the judge's suggestions to make sure that we don't create more problems by
Absolutely.
having people waiting in line.
Yes.
So let me help a little bit on this. I'm sorry, Commissioner.
Can I say something? And I may be going to
Absolutely.
where you're going. You know, this is an 800-pound elephant in the room. This is the 2 million people that we have here in Tarrant County that are going to be needing this. We know we have inadequate facilities to handle this. We also have heard that we are dealing with a number of other entities and facilities that we may be able to utilize very soon. I don't know what very soon is. Is very soon Friday, a week from Friday? Is it? I would like to hear what those facilities are,
Yes, sir.
where they are, and when we can utilize them. And do you have the personnel to man them?
Let me get to that.
Okay.
So- Yes, sir.
So that's the kind of, and I think all this is great, but this probably doesn't, you snap your fingers and that happens.
No,
I kind of doubt that.
that is
But
correct.
that's the goal, that's where we need to be, and I don't want us to stop the process today until we get to that point, or only do 200 or 300 a day. But I think that I'd like to hear what we're planning on utilizing, what is the opportunity out there, and whether we realistically can get these facilities to utilize.
Yes, sir. So, go ahead.
Let me just take a step
Yes,
back
sir.
and exhale, okay? So let's talk a little bit about where we are and where we're going, okay? Because that's what you want to hear. Judge Whitley, we understand what you're saying, okay?
Well, we'll see in a minute.
We understand what you're saying, and it's not going to be a one-day deal, but it's going to be a goal that we're going to work to and get there as quickly as we can.
So my only
Okay,
question, and
so-
I'll let you
so-
go on, but my one question is this. Tomorrow morning, if we wake up at 6 a.m. and it's raining and 50 degrees outside, are we gonna have people lined up out in front of Resource Connection?
Probably so, if we give
Then I'm
shots.
gonna make a motion in a few minutes that we will close the site at that point in time.
At the site being closed, sir, there were 75 people in line, despite
Well,
being
they'll stand there and
communicated.
they'll pretty quickly
Yes, sir.
realize when the door is locked
Stand
that they're
back.
not gonna get in.
Stand back. Okay. Okay, you know, and we will do whatever the court, as a majority, tells us to do.
Well, that's the reason I hadn't brought it up before
I
then.
understand, Judge. So, I do have some comments for the court, so.
Go right ahead.
Okay. First of all, we understand this, okay? We don't need to talk about how bad it is because we see it every day. And in fact, personally, I walked those lines at Resource Connection twice yesterday. I went out there and I walked the whole thing, and it was long. There was social distancing, but it was long. I didn't hear a lot of complaints about it because they were very happy that they were going to get their shots. There are going to be people who complain, and that's just life. So this is how we want to move forward. First of all, Resource Connection was set up to be an alpha pod, and it was set up only for first responders, but that went out the window, not because of anything that we did, it was because of what the governor did and opening up to 1B. So this is our suggestion, and this is how we've been moving forward. We're working currently with the city of Fort Worth to set up a different alpha pod. That means that first responders don't have to stand in line, don't have to be part of that mile-long line to get their shot. They can go there, they can get that. One of the first day or twos that we had at the Resource Connection, and I was out there and I watched them, it went very well. Second of all, the judge is absolutely right. We shouldn't have people standing in line when the weather is bad. We may not be talking about this as much if it would be like it was yesterday, because we've had some cold days. We all know it's January. It's January. So we reached out to the city of Hurst because of their convention center. And the reason we like that facility, first of all, it's large. Second of all, it has underground parking that can hold 1,500 people, so it gets them out of the elements. The way it's structured is that you can have wraparounds so that you can get people into the buildings also. There may be some minor issues about getting people up and down the elevators. We're going to work that out, okay? So we first began working on this yesterday. We talked with the city manager. We started working on it on December 31st. There was no one at the city that we could talk to. We first started talking with the manager yesterday, which is Monday. We already have a draft ILA that we put together in less than a day and talked about pricing, and emergency management has reached out to the northeast sector of the county, the fire departments, because we can use EMTs, we can use paramedics to give the shots, just like Fort Worth Fire is giving the shots at the Resource Connection. And we believe that, and that's out of a possible 100 people needed to operate the site, that's about 15 to 20 people, okay? Yesterday, I authorized Vinny to go to our temporary agency and get 100 people. 100 more people than we have right now so that we can staff that site. If we have to, we can diminish what we're doing at Resource and move them out to northeast to get that site going. I don't like to close that down. I talked with the city manager this morning of Fort Worth, and I know there were some conversations about Wilkerson Grinds. Vinny's people have been talking, that's not a city facility, that's a school district facility. You've been working with them to see if we can get them. That would be a great alternate to Resource Connection because you can put the people inside the building. And if we can get that, then we're going to stand that up also. What we'd like to do is try to stand up a major site at least once a week. We can maybe set up 2, depends. There's more than just having a site available. There's several different things. First of all, the one thing that everyone needs to realize, while we show that we've done with City of Arlington, who's doing a great job, by the way, about 12,000 shots, the supply is still limited. So you need to make sure that you have enough vaccine when you open these sites up and you don't open them up for one day and then have to shut them down because you don't have any vaccine. It's a supply and demand issue. Second of all, the issue that if you go down to Resource Connection and actually walk around that site, you're going to see that those other 80 people, that they're involved in a lot of different activities. We met yesterday with budget and public health to activate. We have at least 200 laptops, brand new laptops now that we're loading up with the software so that we can operate those centers. We're trying to get that backfill administrative technology in there so that we can go ahead and run those centers. So we're moving forward in that. We're not going to get this unless the court says to shut it down. If it's 50 degrees tomorrow, we're probably going to keep Resource open. We'll check. We're going to manage those lines as we have been managing them, but we're going to move toward what the judge is recommending. And if that's the direction of the court, that we close it down, if it's 50 degrees or more, then we'll close it down.
So here's my question. When is Hearst gonna open?
Well, Judge, I'll tell you what, in less than a day, we put the ILA together. I talked to the city manager yesterday. We've already contacted the other city managers in the northeastern part. We're going to move as quickly as possible. Hopefully, we can maybe do something by the end of this week or the first part of next week.
So that by Friday or Monday?
You know, at the end of this week is Friday. First part of next week is not going to be Monday, probably Tuesday or Wednesday. We're moving as quickly as we possibly can.
What about
it's not just
it's
not just the matter of having a facility. It's making sure that we have the manpower to put in there to operate the facility.
Let's take a deep breath.
Okay, well, just a second.
Let's take a deep breath.
Roy, I'll be glad to take a deep breath, but I want to finish my questions. I did not interrupt you.
Go ahead.
Again, when they're waiting in line out at the Resource Connection, where do they go to the restroom?
So we have restrooms available in the building.
You let them in the building?
Yes, sir. And we have agreements or conversations happening with facilities to put porta potties available at that Resource Connection. Again, this is happening organically, was not by design. And the other thing, I know when the weather is bad, but you have to look at all the comments. There's people who are complaining. Those folks were happy. They said, we're just glad that we could get here, get the vaccine. We understand the rain. Yesterday, we hit the top post on Nextdoor with mostly positive comments. People were just happy how well it was organized despite the long line. So there's feedback both ways. The other thing, why mass vaccinations happen with lines, because you can't have a lot of people indoors. There's active COVID outbreak. Gets to policy measures. There are countries that have suppressed their COVID outbreak to start mass vaccination. Our national policy has not allowed that. So there's a lot to balance. When we get a lot of people indoor, it's going to slow things down significantly.
What
Those
do
numbers,
you object to on this?
I've read that, sir. Yes, sir.
I didn't ask that. I said, what do you object to on this?
It's just going to slow down the throughput to something that we can't finish the vaccination efforts in a timely fashion. If we do it the way that everybody's indoor, it's a granular appointment, because we've heard those comments that why I'm getting a block appointment. And if we do a granular like a doctor's office, then the speed slows down. It goes back to what the national plan calls for. Don't do mass vaccines, a distributed effort. You've been in those conversations where the staff or the folks that were supposed to be relied on are calling uncle. They don't have the resources to do it.
But how many vaccines do you do an hour right now?
So about the capacity is about 155 to 165. That's what we've been doing, and we're trying to get up to about 250 at a bigger space. Yes, sir.
Okay.
Yes, sir.
So that would be basically you would need to hold that many people inside of the facility.
Currently, that facility doesn't have it, yes, but the Hearst Convention Center should be able to hold that.
And
yes.
see, that's what I guess I'm getting to, is that, yes, we set that one up as an alpha pod that would have had far fewer people coming in. But it has gotten out of control there. And I believe that we either need to convert it back to an alpha pod, we need to close it down, and if that means for 2 days we don't have a place like that until, I had understood that Fort Worth Fire said that they could open up the bowling center by Thursday.
Yes, sir. So the goal is to do a pilot run on Wednesday, and then they're going to do 2 days live on Thursday. So we're working with them very closely. the original plan, that the discussion was they were going to find us a public site. When they went and looked, at least at their staff level, they ran into some issues. They came back with a Bolin solution. We'll take the first responder traffic and get it to a secure facility. We worked with that. So that's one site that's going to offload some traffic from here.
And then if we can open Hearst,
The goal is to have Hearst Convention Center ready by this weekend, hopefully, and go live sometimes next week. There's a lot to pull together. It will be easier if you all agree that we can close the resource connection and move everything there so we find a good plan.
No.
well, I don't
That's
think,
like one of the only locations that has bus access, right? I mean, we're still relying upon, relying upon the fact that people are gonna have a car to get to the vaccine, and they just don't.
that's where
So-
Grimes comes in.
Sure, but, and
So-
fuel grinds,
But-
right?
Yes. So
Again,
there's
you're-
locations on the bus line.
The problem that we've got is that all of this, as Vinnie said, is growing organically. We're in a reactive mode, and we're not gonna get where we need to go in a reactive mode.
So
We need a plan, and Hearst Convention Center, while it will serve northeast Tarrant County, is not gonna do anything for the fact that we've only got 3% of African Americans vaccinated and 5% of Hispanics vaccinated. We need a plan that is gonna address this holistically.
Yes, sir.
And stop just reacting to every emergency that comes up.
So the only reaction that's happening is that we're activating our mass vaccination plan. We've done this in the past. We know how to do this. Only problem here was the national and state plan did not call for that. It called for a distributed
I
vaccine
get
access.
all that, Vinnie.
Yes, sir.
But we need to, if we need to bring in an organization that can pull together a plan while we deal with the day-to-day activities of giving shots, then we need to do that.
Yes, sir, we are doing that. So let me explain. So,
Or
wait,
is
no.
working with
Wait.
Williamson Grimes.
So Commissioner Brooks, we understand what you're saying, and we need the plan. I think it has to run parallel with what we're doing now. We have to develop the plan, but we can't stop doing what we're doing now.
That's right. So if we need to bring in somebody to help us develop a plan,
So,
let's do that.
okay, so
Yes, sir.
let's talk a little bit about Wilkerson Grimes. Have you had the conversations with the city? Not with, I'm sorry, not the
So
city.
Fort Worth wanted to take the lead on finding facilities in Fort Worth, so they're doing that. We've had conversations about Wilkerson Grimes and the Coliseum, or the Will Rogers Arena, sorry, no, I kind of mixed up the names, the Will Rogers Arena. So those two facilities are in play, they're checking on it, but they wanted to stand up the Alpha Pod first. We've had conversations with MedStar, who's been a helper. With our help, they got approved as a site. I heard you talk about a need to get out into the community, do mobile clinic vaccinations. We have it as part of our plan. Commissioner, we have a plan. It's part of our plan. But when mass vaccination efforts kick up and the public's coming to you, it's hard for us to pull out of that and get mobile. We have to kind of let this sort of simmer down when we get access. I've asked MedStar to start helping. As they kind of work out the kinks in their system and they start to receive vaccine, they are considering that and taking the plan mobile. So they're going to be our helper out in the community to get mobile, stand outside, let's say a senior center, independent living, and run a mini clinic there. So there's a lot of moving parts that we're working with many partners on. As Mr. Mania said, we have Northeast Fire Department Association, 14 cities, and their city departments and the city managers willing to help. We're working with them to stand up the Northeast location. We are debating, now that the location has become public for the resource connection, you can't put the genie back in the bottle. We're trying to take maybe a few steps back and come back with a revised option for that. Maybe a lower volume facility, have the appropriate arrangement for people to not have to stand in the elements. But it's going to take us a few days to not have that facility operational because it's hard to reconfigure it when there's hundreds of people lining up. So that's why we said maybe if we can do everything at the Hearst Convention Center for a few days and come back to it in a repackaged deal, then we can use that facility or we go elsewhere.
The Hearst Convention Center is not accessible to the people I serve.
Yes, sir. We'll present something else to you then.
We have asked for, Fort Worth is pushing forward, I think, with Grimes as quickly as they can, and I hope that it would be by the end of this week or the very first part of next week. And that would be a facility where people could stay inside. They would have indoor facilities, not porta potties. And we could do that, and you're right, that is on a bus route. I think we're talking about, and the staff is working on trying to get this done, but what I'm just saying is we are using the resource connection for a purpose other than what it is capable of fulfilling, and we're putting folks at risk not only of the weather, also of just standing in line. I've had also a number of people who had appointments who got up and saw the mile-long line and said, I can't physically stand in line for that period of time. So if resource connection does not allow for people to be indoors and wait, then we need to go ahead and stop letting that be a 1B facility and let it continue to be the alpha that we have, and tell those folks that are 1B qualified, give us a couple of days. We'll either have Wilkinson Grimes set up, and then for those folks in other places, we got people coming in from all over the region that we're seeing at Resource Connection.
I'm not going to agree to shut down the Resource Connection until there is an alternative that can be stood up at the same time. The Resource Connection may be inadequate, but it's better than nothing.
So you're going to have people standing outside in the rain.
That's a choice that people make.
Well, no, because they're supposed to have an appointment that we've told them to come. It's not supposed to be a choice. That's the other part of the problem. We've allowed it to be a choice that they can make versus you've got an appointment, show up, and everybody else stay away.
The operational details of the Resource Connection are something that we can tinker with. Shutting it down so that there is not an option in that community is not something we can tinker with.
Well, and really it serves the whole southern portion of the county.
We're not going to shut Resource Connection down until we have something like Wilkerson Grimes to stand up, which is just basically across the street.
We're not.
So could we not put up tents? Just like, things that we utilize during voting and all of that, can we not put up tents along the line?
So again, I don't want to keep elongating the operational details, but we have tents out there. It's not going to cover miles that, lines that are very long. It's supposedly a mile, but you know what I mean.
Yeah.
They're very long lines. We've had heaters out there. We've had a fast track line. Anybody in uniform gets pulled out. Anybody with a walker, cane, wheelchair. When we go and check for, are you here for an appointment? We check their age. If they're in the senior category, we pull them into the fast track line. Fast track line moves twice the pace as the regular line. So we've done a lot of operational things.
Well, and I want to be clear. I'm not questioning the efforts that you all have put in place. And I know that obviously that unfortunately we are reacting. And as I said a few weeks ago with the first vaccinations that were given to first responders, is that we were ready to respond. And obviously the situation has changed, which means that we have to reevaluate and pivot. I think what's important, though, is that we have not done a good job in managing the expectations of our residents so that they come prepared and know what to expect. Now, I get, that by and large, that there haven't been a lot of complaints maybe that have been communicated to you or your team, but they've certainly been communicated to me and to my colleagues, right? Yes. And that's just the nature of the game sometimes. But, and I get that you're saying that we have a plan, and I guess your next slide,
It kind of goes over the process, explains some of the things. So what we're doing is combining our efforts and finding some willing partners. Not everybody's willing, but a lot of partners are willing to do a combined single entry registration. So as you all have heard, we've had tarrantcounty.com/COVID-shot as the entry screen. 160,000 people registered, 136,000 currently eligible. Total number of vaccines that we've received so far is 12,000. We've given out close to 8,500. So 3,500 vaccines available for close to 130,000 eligible people. So what is the process? You register. And after that, originally, we were sending out an automated email. But as the registration volume kicked up, we got alerts from Microsoft that you're exceeding the daily allowed volume. IT called saying you're going to get Tarrant County blasted as a domain name that is blacklisted by Microsoft. Shut this automation down. So we did. So we took a different route. We have an automated calling system. So at the end of the day, well, every morning, we take all of the people, 10,000, 20,000 who've registered, they get an automated call. Thank you for signing up. There's limited vaccine and a lot of eligible people. It may be a while before your number comes. We will contact you with the next step. If they don't respond, they get a text message and a voicemail with all that currently you're only signed up. And if you want, you can even express your further interest by pressing 1. Some people do, some don't, but we have them in our list. So then, let's say several days go by, 2, 3, 4 days go by, and their number does come up. And by the time we've analyzed the data, who's eligible, who's not, who's in county, who's out of county, who's in what category, are they critical infrastructure, whatever information's come in, we've analyzed it. So all the people are in different buckets. And we have been pivoting between 1A and 1B as the Texas plan called for. Currently, we're supposed to be only in 1A. They changed the plan on us right before Christmas saying 1B is open and go back and forth and try to do them both. So then they get an automated call saying your appointment number is up. You have an appointment tomorrow at Resource Connection at 9 a.m., between 9 a.m. and 10 a.m. But if you can't make it at that time, because we understand people can't drop everything and get there, come anytime during that day, okay? So that's and so what we're expanding that to is now Arlington's willing to take from that bucket, so they've gotten rid of all their pre-registration process because they were facing the same issues. We've talked to MedStar. They're willing to do that once they start getting vaccine. Fort Worth sites are going to follow the same process, and we're hoping that different hospital partners, different pharmacy partners, others join the effort so we're eating away from the same registration pot instead of everybody having to register separately. But again, everybody has a different process. They have the choice either to follow that or not follow that. So that's how it's currently working. And when they get that second call, that your appointment is up, you're welcome to come, we send them also a link for where they can go fill out a consent form. We, at least in our process, we send them an actual appointment registration form where they put in their emergency contacts and all those details. And so that's how it's supposed to work. What is the confusion that's happening? People sign up and then they show up on site. That is true. We've turned away hundreds of people. Well, I signed up. I heard that it was here. They're standing in line signing up. So we're sending them back. Then second confusion. A lot of seniors, they get the message, and others too, they just get the message acknowledging that you have signed up and we will call you when their number is there. And we've had people show up. Well, I got this message to show up. No, we just acknowledged you're not on the appointment list. And so that's been a lot of confusion. Your office got those, my office got those. Well, I got a message, I didn't hear the whole thing, but where am I supposed to go? Well, we just acknowledged that you signed up. So that people were calling all day, every day. Well, I don't know if I got registered because, you know, they didn't see the screen saying it's saved. So we're trying to work through all of those things. These opportunities here, let the public see what the process is like. And we will continue to educate the public. Again, only 3.5 doses on hand with 130,000 eligible. So it's going to take a while and patience to get everybody through, like you heard. Some people signed up and they're waiting. And I get those calls all day. Where am I in the queue? We're starting to pre-book appointment to our capacity. So in our system, we can see next couple of days who we're gonna invite. But further than that, it's dependent on vaccine eligibility, dependent on where the location's going to be. So there's a lot of moving parts. So I just ask that everybody be patient. Again, this is not a slant to anybody, but throughout the pandemic, everybody has become the expert to tell public health what should be done. Please, everybody understand, public health is the expert. We know, we have done this many, many times. We just need some time and patience with everybody to work through this. Again, the national plan and the state plan did not call for this. And when the vaccine came, well, public health, you know how to do this. Let's get this done, and at a very fast pace. We get it. We will make it happen, and there's a lot of partners willing to help. But it just takes a little bit of time to put the operation together. As you know, staffing resources are currently, working on the outbreak. If we move away from there, we got other problems. So we got to hire new resources. There's city partners who are willing to help us with the resources. It just takes time to assemble an army, and that's all we're asking, just a little bit of patience on everybody's part so we can get this done right. Final comment, we absolutely hear what you're saying. We're finding locations that have covered parking. Our existing mass vaccination plans had school stadiums and indoor facilities with seating, but there's a COVID risk and they don't have covered parking, so we're finding new locations. So there's a little bit of wrinkle with COVID being around. So there's a lot of things that we're doing, and the team's working real hard, not just us, a lot of our city partners. So just give us a little bit, we'll come up with a better plan. And trust me, there's a lot of positive feedback coming too. There's people who complain, but there's more that have given us positive feedback, and I hear that as well. So please just let us work on a plan, and we'll come back to you with a little bit more clear plan on how we're gonna do this.
Okay, so here are two complaints that I've gotten from quite a few people. One is there's perception, there's reality, but the perception right now is that the system that's set up is to favor some over others. And there's a lot to that, right? But we have to be able to manage that. Two is I've heard from quite a few folks who did get the first round vaccine, and now they're concerned because they either through their experience in getting the first round vaccine or what they're hearing from others, now they're concerned that there isn't an organized mechanism for them to get the second round. So speak to that, please.
Yes, ma'am, there is. So sure. Our systems have the automated calling ability. When their second dose comes up, they get an automatic call. So here's the other, again, I hate to get into operational details because this is not the venue, but issue is you call people. We did 2,000, let's say, on one day. Their 2,000 doses are up on 28 days. We call them. Not everybody shows up. So you got to give them time because the government or the Moderna guidelines allow up to 4 days. So you got to give them time to show up. That's going to create backlogs and traffic jams. And then people go everywhere. So we're educating them, and we're giving them the CDC card with Moderna clearly written what lot number. So if they show up at a pharmacy by then, or they're in another city and they go up to a public location there, they can show their card, and we're educating them, ask for the Moderna vaccine. If that was not complicated enough, other countries, England, for example, has tried to fast track. They're saying only get one dose to everybody, let's worry about the second dose later. They're allowing mixing and matching of vaccine on the second dose. Our national policy currently states 2 doses must be given, must be the same vaccine. There's a lot of discussion up top if that's going to change. So again, a lot of moving parts with this pandemic. You all have been familiar with it. It's fly by the seat of your pants on a lot of these things, and we're just rolling with it. So again, I don't want to belabor the point. We'll come back with a revised plan. Mr. Manias has been helpful. Our team has come up with a lot of options. But as Commissioner Fick has said, there are limited resources. We're going to have to raise a lot of resources, whether it's ours or city partners helping. It's just going to take a little while, and that's okay because the vaccine is very limited. The point I want everybody to remember, we are the North Texas leader who got the vaccine out very fast. So we know how to do this. A lot of places don't have what we are doing. I'm getting calls from all over the state. How are you guys doing this? So there's a lot of positive feedback and a lot of just, how are you doing this? Because we are getting it done. So I want you to remember that positive message as well. I know you get a lot of feedback like this is not good, but there's a lot of good happening here as well.
Let me just comment that nothing I have said this morning is a criticism
Oh, yes, sir, I understand.
of Tarrant County Public Health Department. I think we've got the finest public health department in the nation. I think your leadership of that department has led to the fact that we are recognized as the organization that got the shots out there the quickest and to the most number of folks. My suggestion
Yes,
is that public health is so in the weeds dealing with trying to get the shots out there, trying to manage the demand and the limited supply, that you don't have the bandwidth to plan. And I continue to say that in order to be successful going forward and to immunize Tarrant County, we can't do that without a global, holistic plan. You say you're working on it. I don't know how you have the resources to do that. What I would be asking this court to do is to provide resources for planning.
yes. We'll be happy to take, and we're very appreciative for your support. And like I said, we'll work with Mr. Manius's office. We'll come back and ask for whatever resources we need. And we, again, thank you. Your feedback is well taken. I don't take this as criticism. You all are the leaders holding us, our feet to the fire. So we get it. So we'll get it done. Yes, thank you. Any other questions or comments on any of the other information?
I mean, I'm
Yes, sir.
still at the point to where if you're saying you're not gonna close the resource connection, you made the statement. And what I'm saying is then at a minimum, we're gonna have tents out there, and we're gonna have heaters out there for the entire line, and we're gonna have porta potties out there.
So we delivered 20 porta potties this morning out there. And we do have tents for at least, it looks like about 50 yards to me.
Yes, sir.
Before you get into the door. I've saw
Are they
those tents.
tarps or are they tents?
They're
Tents.
tents. They cover the sidewalks.
Yeah. They don't have sides because we can't have, we need airflow because COVID is still a risk.
What I meant by closing resource, we've heard what you said. We need to have an alternate that's on a bus line. If we get Wilkerson Ryan set up, well, then we need to reevaluate closing resource because resource has its restrictions. You know, it's functioning, quite frankly, it's functioned pretty well. We've been giving about 1,300 shots a day.
Is there any problem with you basically saying don't show up until 30 minutes before your appointment?
Well, so, yes, sir. So we have signage that's in the print shop. I think it's going today. If you want, I can share this with you. There's
Let me have it. I'll
Yes,
share
sir.
it with them.
There's 4 different kinds. 2 in the back address very clearly, no appointment, don't come back later. And I'm paraphrasing. And the 2 in the front actually talk about timeline, because people ask how much longer. So we've kind of estimated how much longer to a certain spot. And again, that was again to address the current plan. Mass vaccinations always have lines. So we have there, you have 1 hour, you have 2 hours, because again, it just takes a little bit to get all the people done.
So are you telling people to show up at their appointment times or whenever they want?
So if somebody has no appointment, they're being sent back. We're inviting people on an hourly block. Your appointment's 9 to 10, 10 to 11, show up then. What we're giving flexibility is, let's say, I think you got a call the other day, 10 a.m., show up to get the vaccination. Well, you're gonna be in Commissioner's Court, you can't drop that and run and get the vaccination, so we're allowing flexibility, show up all day that day. So what has happened, people have missed their day because life happens. I was away, I had something else. If they show up the following day, so far, we've been accommodating them, but I'm hearing from a lot of people that they're starting to cut that out. In our view, in the public health view, that's a little unfair because we only gave them one opportunity to get vaccinated. So if you would let us kind of work that, we can try to load balance the days on how to manage that. And if it doesn't work, we'll cut that out. But we're trying not to send people away that are clearly eligible, just couldn't make it on the time that we assign them.
Well, I mean, that goes against the basic tenets of public health, which I
Yes, ma'am.
understand that. But again, it goes to my point about managing expectations, which I would love to communicate out to my constituents what they can expect. But honestly, I'm just learning this now.
Yes, ma'am.
So in addition to this, whatever else to, some boilerplate stuff that we can send out.
We will.
And so that with each community leader that calls me, each constituent that my staff talks to, then we can be reiterating, here's what you can expect for right now. I think that would do a lot to calm down some of the confusion, and then some of the anxiety just associated with the whole process. Because folks are very anxious about it, whether they're in line to get it, or in the queue, or they don't even know what to do with the URL,
Yes, ma'am.
Benny,
Yes, sir.
I think, I just want to be sure, I had a gentleman call me yesterday, and he's actually signed up to speak today, and I don't want to take away everything he's going to say, but I think he had an appointment, I want to say at 11 o'clock, showed up, was told it'd be a 5-hour wait, was then told that we're not going to be here in 5 hours, so you're not going to get a shot. And he had an 11 o'clock appointment. He goes home. What else is he going to do? So I'll let him tell, if he's, no, I think he's here, I'll let him tell the rest of his story, but I just want to see that kind of stuff not happen.
Understood.
Okay.
And we're working on it. So perfect example yesterday, we had to cut off the line. So we knew there were people backing up at 1 o'clock where we won't be done. We auto-called everybody that had an appointment to 1 and 3. If you're standing in line at the resource connection, we have overcapacity, so you can leave, and we have priority hours for you the following day. So today in the morning, 9 to 11, only those people that missed their appointment are being called. After 11, rest of the new appointments start. So there's a lot being done. Again, this is not the platform for operational details, but we know how to do this. We just need a little bit of time.
It's not the place for operational details until those details aren't working.
Yes, sir, I understand.
And then we're the ones that get the calls. And so if you knew at 1 o'clock that you didn't have enough, how is it that you know how many shots you can give an hour, and you set up those number of appointments, then how is it that you don't get through those appointments?
So, like I explained, over the last week, with the holiday and the weather, we were getting 25 to 30% no-show. So we've been overbooking ourselves to get to 100%, because the goal is to get the vaccine out fast. And yesterday the weather was nice, and the holiday, holiday mood was gone, right? So everybody showed up, people who had their appointment, people who missed the appointment, and of course we called more people than what our capacity was. And then the regular 50 or so or 75 or so that show up without an appointment, those folks were sent home. And then we realized in the afternoon, well, there are too many people and not enough time to get them all done. So we started to weed them out. Some people agreed, some didn't. And so we got done what everybody was there, and at the end of the day, we had sent 100 people home. Now, there were people who left, and we saw that because they acknowledged the message. So this morning, around 300 people were invited between 9 and 11 that had missed their appointment. And after that, the regular day starts. So there's things that we're managing on a day-to-day basis. Constant feedback I get is, well, there are people in line that are out of county. Well, yes, because there's a lot of city county workers, a lot of first responders, a lot of doctors that live outside of the county. We are inviting people that are qualified under those categories. And, some of that is honor system. I mean, have other people snuck in through? Yes,
So look, so I think we've
I
fully
I
heard
do,
what
I have
the,
a policy question. So with the directive that we got from Dishes to combine 1A and 1B, or to pivot in between, is that a shall or a may?
You shall. They have been very terse. And some of the frustration was in their data, that is not accurate. They're seeing a lot of vaccines sitting around. So then they sent it to all providers. It wasn't just directed to public health. All providers, hospitals, private doctors, pharmacies, whoever got it. Everybody's supposed to do this. So if we eat away at the distributed plan, this will not become an issue for very long. There's limited supply, and there are a lot of partners that are not, at this point, doing what we're able to do.
Sure.
Because their concern are their facilities are going to get overrun. And that's adding extra burden onto us.
It is. I mean, my main concern is making sure that those who are the most vulnerable are actually getting the vaccine. And I know obviously there's part of the system, you know, from the back end that you all are making those determinations and then also going upon the honor system. But I am concerned if our first responders don't have access to the vaccine, when obviously they are risking their lives every day to care for all of us, including those with COVID. So that's why I want to make sure that I understood really where that
So the plan called for 1A, which included first responders. 1B opened up and it cluttered it a little bit. We are, you know, getting 1A, or well, mostly first responders pulled into a alpha pod separately. Because we understand they can't stand in line for this long because they have calls that come, they gotta go. We understand that, yes ma'am.
Yeah.
I hope that as we get into the 1B, that we'll also find a way to filter teachers.
So that's already happening. If they're in 1B and they're teachers, they're already getting immunized. So we are doing anybody that's 1B eligible, because I get calls, well, I'm in a Texas National Guard. Do I have special access? Well, if you're in 1A or 1B, yes. Otherwise, I have reached all the way up to the SHS, the eVAP committee, and asked them to evaluate critical infrastructure. Federal 1B was critical infrastructure. Texas did not address that, moved to Federal 1C. That has become our 1B. And that's a huge volume of people. In the 1B alone, there's 500,000 in Tarrant County.
so let me suggest something. We need to take about a 10-minute break because we have a data issue that we want to deal with so that we can continue to record this meeting. Is it okay if we take a break now and then come back to this conversation?
Yeah.
Your Honor, we're ready back there.
Do we want to wait for Vinny to get through and then?
I think he's finished with his presentation. If you all want to make more comments about it, then that's good. But
Okay, we'll go ahead and then restart. I guess the only comment in addition, I said something about having tarps and heaters. Let's have some chairs out there also for them to be able to sit down, because a number of those folks just can't stand.
so what we've done so far today, we've extended the tents to push them out even farther. I do want to correct something. I'd received a note while we were in court that we've already received the 10 porta potties. We'll receive them within 2 to 3 hours, and so we'll have those set up. And just a closing comment. We heard everything that the court talked about today, and we're going to aggressively move forward on this thing. And hopefully you'll see. We'll try to communicate better with the court members than we have on where we are and where we're trying to go. So. I appreciate the support of all the members on what we're trying to accomplish. So, Your Honor, we have, at this point, we have several audience participation forms. I believe we just have a few. I think we have one call-in, and there's, I think, 4 in person.
Yes, and I think the first one that I've got is Matthew Redazzo, and then followed by Blanca, followed by Doug Hines, followed by Sherrod, and then the call will be to Don Martin. And so at this time, I'll call on Matthew Redazzo. Is he in the back room, or
Said he was coming.
Oh, he was here earlier. Well, I say that, I'm not sure, 'cause we had this form yesterday.
Well, he was the gentleman that called me that was gonna come up and visit.
Well, get him up there. Let's go.
Okay, Blanca is next, and then Doug Hines, and then Sherrod Perry. So Blanca, if you'd come on down. Is anybody back there?
There's two people, Your Honor, but not Matthew.
Okay, I just called on Blanca and Doug Hines, and so
You ready for them?
I'm ready for them. Come on down.
Good afternoon. Thank you for having us and listening. Listening to this is like being in the twilight zone. Unbelievable, unbelievable that we have been so hoodwinked and so deceived into thinking that not only the masks, the lockdowns, but now that the vaccines actually work. What is going on? Whew, I have a handout if I can. Do I hand them to you? This is something that you'll find at LifeSite. Last week I mentioned the different sites that verify the alternative medications to the virus or whatever it is that it is, which is more or less the same medication that they treat radioactive poisoning. But this one, doctors petitioning the EU to stop all COVID vaccine studies due to grave risks. More doctors. There's more recommendations here. I have another one here that I'll bring next week, the copies, which comes from anomaly.com, some of the recommendations that he makes. But all I can say is today that I can only pray, because it's going to take the power of God to break the deception. If we can just look at Sweden, that had no lockdown, and their numbers were about less than, very little less than, but about less than. Then you had South Dakota, which didn't have any lockdown. The same thing. The numbers are there. The evidence is there. What is going on? The same people involved with this virus, this Fauci and all them crazy folk are the same ones that were involved with the HIV virus that was then traced to the different government programs. Then we're trusting in a vaccine, for heaven's sake, that has killed so many children in Africa. So many children and people have been affected here. We don't even know the great risk that it has to the population, particularly the minority population, particularly to the senior citizens. Well, it would be a great way to relieve the Social Security, just kill them all. I don't know. But you know what? It makes me think. I think that we have to start using logic. In some counties where they had no lockdowns, where they didn't use the mask, where they're not pumping no vaccine, they have better. The people overall are in a better state of mind because they are controlling their lives. That the government should never be controlling somebody's life. The government is there by the people, for the people, not to control the people. That is communism. That is socialism. And that is not freedom. We want our freedom back in America. Thank you.
Next is Doug Hines. While he's coming forward, I would note that South Dakota has more deaths than we do, and the state's population is less than half of ours.
Judge Whitley, Commissioners, Happy New Year. In the Happy New Year time frame here that I want to talk about, 2021, I think it's a good time to look back at 2020 and see what we did in 2020. I think there's a lot we could learn from 2020. I think we should do so. Let's look at what we tried and where we're at. outbreak came in, roughly March, February, March. The governor got involved and started issuing these edicts, these EOs. And things have gotten, well, you've got social distancing, you've got the mask mandate, you've got the business closures that were tried, isolating people in nursing homes, isolating people in hospitals, locking people out of seeing their loved ones in hospitals, and all those things that have been done. And then see where we are right now. As 2020 closed out, we're at an all-time high, allegedly. All-time high of people testing positive, allegedly, for COVID. All-time high people deaths per week, I think is an all-time high. So what we've learned from 2020 is what we're doing in 2020 didn't work. I don't, there's no logical way to say it did. It didn't work. So 2020 is a great time to get it behind us. Let's see what we did. Let's see where we came out on 2020, how to work out for everybody, and what's going to happen if we don't learn from the past and do something a little different in 2021 is this whole thing is going to lose a lot of credibility. And credibility is what government is based on. When people stop believing the government, they stop following the government. And when that happens, that is not a good thing for the people, and it's not a good thing for the people's leaders. You were all elected by the people. I'm sure you all have sound minds and good hearts. And I think you all have the capability of seeing what's going on. And I'm not sure what's keeping you from doing something good to make it happen, to make it fix, to make it better. But what this commission has done throughout the year, following the governor's mandate, I understand the governor put the mask mandate in there. We put the business mandate in here for Tarrant County under you, Judge Whitley. Hasn't worked. It just hasn't worked. So let's kind of come up with a new plan. What I saw today was like, wow, hope is not a plan. I hope things get better is not a plan. Let's get a plan together that works. Let's learn from the past. Let's do something that works in the future. Therapeutics are out there. I think if we took all the vaccine money and started pouring into therapeutics, maybe do both. I'm not in favor of vaccine. I'd walk through the gates of hell before I took one. But I will tell you this, the therapeutics do work. It's been proven to be working. We should put some money behind therapeutics. We should do it on every street corner, right next to the vaccine if that's what you have to have. But the therapeutics should be out there, and I know from personal experience, in my own family, they work really well. Learn from the past. Let's get on with the future. Let's make it brighter. Thank you.
Thank you, Mr. Hines. Sharon Perry.
Okay, well, good afternoon, everybody. All right, so like I said, I may not be coming up here too many more times because I feel like I've seen enough to know where this is headed. But last week, I made a pretty strong claim. So I wanted to come back at least this week to kind of add some support to that. Because last week, I actually came in here and told everybody that there is no virus. All right? And again, like I said, what I have here is a report. Back in November, about 20 or so scientists got together and they looked at this PCR test, or they looked at how this PCR test sort of came onto the scene. Because back in January of 2020, all right, this PCR that they're using to detect the virus, basically, I want to tell you a few things that these scientists discovered about this PCR and about just basically they're saying that the whole way that this test is designed makes it completely worthless. And they make a few good points that I've made in this courtroom, actually. But I'm going to try to run through a few of them quickly. One thing that they point out is that the scientists there's basically two authors of this sort of PCR instruction. So again, in January of last year, they came up with the instructions on how to use a PCR to detect this virus. And the paper, the protocol, basically was published one day after being submitted. Okay, that's one flaw, is that if you publish something within one day, that means no one got to review it. So there was no peer review of this PCR protocol. And a day after that, the WHO took that protocol and ran with it. So again, that's one issue. And the journal that it was published in, which is called Eurosurveillance, it just so happens the authors of the protocol are also on the editorial board of the journal. So they literally probably approved their very own paper by working for that journal. So again, these are the kinds of things that make everything look very fraudulent, okay? But again, like I said, the test itself, as I've said in here, it's not detecting a virus anyway. It's detecting snippets or fragments of this virus sequence. So it's looking for certain RNA pieces or RNA sequences that supposedly only that virus has. That's what, as these researchers are saying, that's not the case at all. This test is not a gold standard, as they say. It's not. It is the chance of it detecting something that's not the so-called virus is very high. And like I said, I held this book up last week. I hold it up again, The Contagion Myth. The contagion myth. And essentially he's saying that viruses, what we call viruses, are basically byproducts of poisoned cells. So if your cell's been poisoned by radiation, if it's been poisoned by radiation or toxic air or toxic food or toxic water or toxic emotions even by fear and stress, then what we're calling viruses are actually what they call exosomes. So again, and one more book I'll hold up is Virus Mania, which I've started reading, but I haven't gotten too far with it. But it gives you a history of how we've been through this. We've been through this before with other viruses such as HIV, such as polio, such as swine flu, where the medical industry basically takes these and they use them to
Thank you, Mr. Perry.
to profit. So there's a long history behind all this, and we're falling for it again.
Next is Dawn Martin, and I'll call her at this time. Hello? Okay, we'll try one more time. I know. But then it didn't.
Hello.
Ms. Martin, this is Judge Whitley. It's your time on the agenda for any public comments you wish to make.
Yes, sir. Thank you. So you keep saying, do your part, wear masks and social distance. The majority of people are doing these things, and the cases and numbers continue to go up. This is the true definition of insanity. We keep doing the same thing over and over and getting the same results. Places like Dallas-Fort Worth, Houston, even cities in New York and California are seeing the rise. The cities and states with no mandates are not seeing these spikes. All we hear is fear-mongering and manipulation of data, and keep seeing the same results. What your so-called experts are telling us to do does not work, period. This is insanity, and it must stop. Your plan to vaccinate everyone will also not work because you've had months to plan, and you can't even seem to manage that. And so if you seem to want to push the vaccine like a used car salesman, we don't want it. We're over it, we're tired of the mandate, and we're asking you to, like Doug said just a few minutes ago, reconsider what you're doing and reconsider the plan and change tactics. Thank you.
Thank you. Okay, that's all of our audience participation for this week. So, Mr. Manius?
Thank you, Your Honor. Members of the court, we're going to go to the administrator section to item A1, and we're going to start. Remember, we had told you that Guidehouse was going to present to you a wrap-up of calendar year